Good afternoon. Welcome to the IAPHL Weekly Supply Chain Review, Episode 2. Dr. Olaiya, it's a pleasure to have you with us today to our Episode 2 IAPHL Weekly Supply Chain Review. Dr. Abiodun Olaiya is a public health supply chain expert with more than 12 years of professional experience. He has 61 scientific publications, authored 2 public health management books, and engaged stakeholders at regional, sub-regional, national, and global level for health policy development, designs, and implementation of policies, programs, projects to achieve sub-regional and national strategic objectives. Dr. Olaiya holds an MBA Supply Chain Management with distinction from the Malaysian University of Science and Technology. He has 2 certificates in logistics for health commodities and monitoring and evaluation framework for HIV and AIDS programs. He has certificates in project management from the US Center for Disease Control and a PhD in public health with distinction. Dr. Olaiya has extensive international experience supporting health supply chain sector in the United States of America, Kenya, Ethiopia, Ghana, South Sudan, Niger Republic, Togo, Benin Republic. He has had work experiences with World Health Organization, Management Sciences for Health, United Nations Children's Emergency Fund, UNICEF, Axios International, and Medicine Sans Frontiers International. Dr. Olaiya has been an MPH and PhD local guide for the Department of Public Health, Texila American University, Guyana, South America, where he's currently a faculty member. He's also a visiting professor for Texila American University, Georgetown, and a facilitator for Malaysia University Science and Technology, Abuja Study Center. It's a real pleasure to have you with us. Your profile is outstanding, and we really welcome you to this interview. And I hope you're having a great day, sir.
Yeah, thank you so much, Shison, for having me. And starting on the city protocol, just as I mentioned, it's nice to be here to share.
So one of the questions I would ask is, what was growing up like for you? What influences that have shaped you into the role model you are now?
Of course, my primary school was at Sebita AC in Akure, and I moved to St. Thomas Aquinas College. And from there, I proceeded to Ladu Capital University, where I have my first degree. And of course, I moved to Malaysia Science and Technology for my MBA Supply Chain Management, and I also have another master program in Master in Public Health Management from Benin State University, and of course the master MSc Medical Microbiology before I wrap it up with a PhD in Public Health. So it has been a very wonderful time, wonderful period, a lesson, a lot of time I failed, a lot of time and I learned from the failure, and a lot of time I've also succeeded in a lot of meeting with a lot of people. So growth has been a very, very challenging. Of course, how Nigeria growing up being in Nigeria, you have to be very strong, you have to be very sound, and it can be very, very interesting actually. Thank you.
Okay, so sir, can you share your logistics and supply chain management journey with us, and from the time of graduation?
Yeah, I would like to say that when you look at logistics and supply chain, it all started from when I was a student, because I remember then, in the laboratory, my organs would say, okay, can we please take an inventory of some of the lab reagents that is going to be used in terms of looking at the lab reagents. For example, you need to take the inventory of to know how many reagents. For example, you have the tally card that's set out what has been consumed over the period of time, or anything you are picking from the shelf, you have to update it on the inventory management card. So the supply chain management and logistics have been a very good experience for me, because it's an area that is very silent, and it's an area that can actually decide the success of every program, even across X sector. So when you now move, when I left the university time, my first experience was to work with on a global fund project where we manage malaria commodity like LLIN, ACT, all the ACT 1 to 4, and of course RDT for testing. So and I also included some of the family planning commodities, which we actually tried to give it to over 400 facilities there in Benin State. That was my first time. And you know what it means when you are going to do a lot of distribution to 400 facilities, because the system has to come from, the commodity has to come from the warehouse, the central warehouse, to the state level. And at that time, we have to pick it up based on the order, based on the consumption pattern of each facility, ensure that all the facilities that were supported receive all this commodity. And from that time, I picked a lot of interest in supply chain management. I want to learn more, because I discovered that all the programs actually rest on supply chain management. And of course, that was how I actually moved from that, from that project. I entered ASIOS in 2012. My first experience after my global fund program was to move to Kano to work, and then in Kano, I was the regional advisor supporting about 7 states in Northwest Zone, and it was a time when when GAIN project, for some of us that know GAIN project, was transiting from GAIN to CDAS. So, and then I was working with ASIOS Foundation, now Akesis Health, so to manage the 7 states of the nation to ensure commodity security, to see that commodity actually gets into the facility at the right time, at the right place, at the right condition, and all these other right of logistics. So were also put in place that time. So, and from there, I moved to IAPHL to also do the same thing on supply chain management, to see that we are supporting our partner, then GSI, and of course, we moved further from IAPHL, Port Harcourt to IAPHL Lagos. You can see how I've moved, and then from there, I eventually got an opportunity to also serve in South Sudan under Dr. with Africa, and supply chain management was one of the core components that are actually shaping. So it was more of working on supply chain from even right from its university days and up to the level of where we are now.
Wow, so that's really interesting. So from your profile, you have experience in public health. So as an all-rounder, what's the meeting point between public health and supply chain for you?
All right. Yeah, when you say all-rounder, I think it's a good time for us to begin to look at logistics and supply chain management as a backbone for all the interventions. When you want to talk about public health, is a backbone for public health success. You want to talk about vaccine, is resting on supply chain. You want to talk about HIV/AIDS program, malaria, TB programming, or any form of disease, any form of intervention you want to render. I would say that there are a lot of them are actually resting on supply chain management. So supply chain management is just like a pivot, a fulcrum by which the public health is resting on to succeed. Beyond public health, you look at also nutrition aspects, where supply chain management is also very critical. So we want to talk about interventions on several programs, supply chain management. So supply chain management is very, very strong and is strongly related to public health. And so, of course, you know that supply chain management will have a lot of diversity. Thank you.
Yeah. So, sir, based on your experience both abroad and locally, Nigeria, how do you relate the logistics and supply chain practices in Nigeria compared to abroad?
Okay, yeah. When you look at Nigeria, for example, Nigeria has a population of over 200 million people, and that is the largest in Africa. And it's estimated that by year 2050, Nigeria will be having a population even above that of US in year 2050. So that means Nigeria is large, is big, and when you compare it with many other places, few places we've worked, there is a common habit that the bigger your head, the bigger your headache. So yeah, so Nigeria is likely to face a lot of supply chain management, and one of the key components or key challenge that we have in Nigeria, for example, is the poor infrastructure. We don't really have infrastructure. Some of the infrastructure that's currently existing are actually maybe basically built on a lot of private partnership or a lot of full, they're supported by partners. So these are the things that and then when you compare supply chain management with, in Nigeria with other countries, you also talk about the policy and regulatory issues. So as I said, the bigger you are, the more you should plan more. The more you should look at your policy, your regulatory to implement a quality, and a standard programming. So another issues with the country which I've seen is the level of integration. Of course, integration, the level of integration in Nigeria may be a little bit deeper because a lot of multiple partners are working compared with other countries that just like maybe 7 million, 30 million, or few numbers of population. So it's also actually the same, the issues are also very, very the same. And another critical problem we need to also look at, which I said, when you compare with other countries, is the issue of the human resources. Nigeria does not have adequate human resources. When you look at supply chain management, you look at how many people are actually be trained on supply chain management in the country. How many people have, the certification or competency in terms of be able to forecast, also talk about the suppliers and many other areas, of supply chain circle in the country. So these are the big challenge that we need to really look at for. So we still have inadequate human resources, which are one of the factors that which we looking out for. And of course, I'm aware of the national drug policies, Nigeria supply chain policy for pharmaceutical, national drug distribution guidelines. I'm aware of a lot of regulation, a lot of policies, even the one of recent on supply chain management. But the question is, implementation is also a challenge in Nigeria compared with other countries. Implementing some of those policies is also come with a lot of challenges. And I think lack of private partnership also, or inadequate, let me use the word inadequate, of the PPP, the public partnership, is also one of the things that when you compare Nigeria with other countries, and these are the things that when we build on, we can actually get there. Thank you.
Yeah. Thank you very much, sir. At least this part of poor infrastructure and then inadequate human resources. So in addition to what you said, what are the ways you think we can work on now to improve the supply chain system in Nigeria?
Yeah, thank you so much, Shisom, for that question. As I said, I mentioned the function of infrastructure. We need to really, the government needs to, number one, have a partnership with a lot of organizations. Every country in the world that are growing, when you look at Nigeria, for example, Nigeria is having the highest GDP in Africa, 27 in the world. Nigeria have the potential to really go beyond just being number 27, the richest country in the world, and first in Africa, to number 7. Now, what do I mean? Every developed countries are run by the private, are driven. Investment are driven by private. So there is a need for Nigeria to develop its infrastructure, to have a strong partnership, with a lot of private organizations, so that they can run it and, take us to that level we are supposed to be in the world. Number one. Number two, we also need to look at the policy. Some of our policy implementation are very weak. So you need to begin to look at policy. How are we monitoring those policies? Are there people responsible to monitor most of the policies that are developed for the country? And what are the challenges? What are the bottlenecks? So we need to identify those bottlenecks that are those bureaucracies in terms of policy implementations, and remove those interagency rivalry, and move forward. So another thing that I think we should also be looking for that can also help us is that we need to also begin to build the human capacity. We need to begin to look at supply chain management. Thank God for most of the schools that are now running supply chain management at the level of first degree. I remember one of the schools in the eastern part of Nigeria, I think it's Suka here, that they started as first degree. I also saw that also in Kaduna. So we need more education, more knowledge, more skill, so that people can begin to learn about how we can improve on our supply chain practices to prevent stockouts, of course, to improve on our forecasting, on quantification, and of course, this is going to also increase the number of human resources that we have. So these are the things that we need to also look at for, and then we need to begin to have a system that integrates. The government needs to sit at the leadership, at the driver's seat, to make to drive the process, so that we don't want this process to be driven just by the private alone, but we want that collaboration where the government is sitting at the driver's seat and moving that. And I think these are the core areas: the area of policy, the area of infrastructure, the area of capacity building. Thank you.
If you had to go back in time, what would you do differently in terms of your career progression so far?
But for me, what I would have loved to do differently, I think it's one of the things in terms of training. I think I would have had more trainings on time, and then maybe more capacity building on time that would have made a lot of difference. And then for some of the places I've worked, what I would have done differently would have been increase more of a partnership with most of the donors I've worked with that time, to increase our partnership, sharing a lot of information and ideas, because I know at a point integration and was a very big challenge for us. So because a lot of competition among donors and partners, so I think it would have been better those days to have more collaboration and to be really sincere in terms of getting things done on time. Thank you.
So the final question is that IAPHL Nigeria, we are repositioning ourselves to actively combat the 21st century health supply chain challenges. And as a member, and a senior member at that, and a technical partner, what is your expectations of this association?
Okay, I've been part of this association for the past since 2018. I joined at the Kemoni's office, physical meeting. I remember those days, Thomas Bernard and many other colleagues were there in the meeting, so I've participated in that meeting before. My expectation for this meeting is, or for this association is, it should be an association that, apart from maybe being registered in Nigeria, of course, have a clear goal, because we have a lot of the same association in several countries now. one of my expectations would be that we solve a lot of supply chain management problems. And how can that happen? Number one, we need to increase on our advocacy. Advocacy for infrastructure. The association can advocate for infrastructure. The association can also improve what we call the private-public partnership. They can facilitate that, and the association will also serve as an association that building the capacity. Because since we have a lot of low human capacity, to build a lot of capacity so that we can have a pool of human resources to solve our supply chain problem. I think these are my expectations. So, and it should be an association that also public scientific publications that talk about findings from supply chain management, because we discovered that there are little little publications, scientific publications, peer-reviewed journals on supply chain management in Nigeria. So the association should be coming together, since a lot of people here are public health logisticians, should be bringing data that can inform decision makers. Those publications can inform decision makers. So these are the things that I'm expecting IHPF to be looking, and organizing conferences, organizing a lot of webinars, just like we're doing now, and a lot of education that can promote supply chain management in Nigeria and also in Africa. Thank you.
As your role in the academic sector, what is the relevance of having people with BFAM incorporated into the BLMS?
One of the things that happened, I remember, it has to start with the curriculum, the university curriculum, and the advocacy need to get to the university, and of course, Nigeria, the NUC are actually responsible for most of the content development or regulation about of university. So number one, there should be a strong advocacy. We've started this strong advocacy during some of our conferences, where we say supply chain management should be a full course. I'm sure for BFAM, supply chain management is already incorporated. It's not new. In fact, at the high level, I have seen where they also talk about supply chain management and farm care. So I'm sure for maybe it may now vary from school to school, maybe from university to university, in terms of implementation. But this is not new. Supply chain management has been suggested, is needed in both BMLS and BFAM. Not only to BMLS and BFAM, there are other people that are studying nutrition, for example, that are going to be talking about nutrition. Don't forget, we have a lot of commodities that are nutrition based. So they need to also have some basic knowledge on supply chain management. So, and as I said, supply chain management rests on many things. So, but this is something that many universities, I know Isuka have started as first degree, and the Kaduna has also started. I know about 2 universities in Kaduna. I think 1 poly and 1 university have started in Kaduna State. So I think it's going to be gradual, is needed, but we need more advocacy at high level to see that supply chain management is incorporated into the program, and so that people can actually specialize.
So, Sal, any final words?
Yeah, my final word would be to the organizer of this program. Number one, to appreciate them for excellent work they're doing. What's spoken has a long way to help people, and they should keep focus, and all the vision that you set out to achieve, ensure that you plan to achieve them, and make sure that this program is also being organized. And then maybe in future, we can be looking at making it a larger conference where people can make an abstract, people can present. A lot of us have been part of, even at the level of Africa level, where we have to organize, webinar conferences. So a lot of people that are skillful in conferences, so we should be taking it beyond just a weekly or a update, to the point that people can now begin to share more ideas like abstracts. People can come and present their scientific findings on supply chain management, because it's very key and very important. So thank you so much.
Thank you very much for honoring this interview. I really learned a lot. I really appreciate. Thank you very much. Have a lovely day, sir.